I'm Dr. Maria Nelson, the Division Chief of BEST, is Breast, Endocrine, and Soft Tissue Surgery at the University of Southern California Keck School of Medicine. I always thought that I would become a doctor. I had asthma as a young child and two non-medical parents that probably didn't identify my triggers as well early on, and so that meant I was in and out of the ER a lot, and I found that I really saw the medical people as helpers, and I thought to myself, I want to be a helper like them. And I know that sounds kind of simple, but it really had an impact on me. And then as I got through medical school, I started to realize I really liked the surgeons and how they were able to take care of problems. And I also was drawn to women's health. And then later, as I went through surgery, I realized I was very drawn to breast cancer and the complexity of the decision making and how you had continuity with your patients. So all of those reasons kind of collectively formed my interest and led me to do breast fellowship and ultimately breast surgery. The best piece of advice that I received was treat patients as though they're your family member. And so that's the advice I try to follow. We have a tremendous asset in Dr. Fumito Ito. He is newly joined our BEST faculty. He is a research scientist, so he is both a surgeon, a medical doctor, as well as a PhD in immunology. And his focus is really to look at, is there a target that we could potentially use to our advantage to identify cancers earlier? Are there ways to treat locally advanced cancers with injections of targeted therapy right into the tumor? This is fascinating to us and hopefully brings around a whole new era of treating breast cancer and trying to get at it in multiple ways, both detection and treating it directly. If we were to have a grateful patient or someone in the community who wanted to support us, we would certainly accept gifts to support our causes, such as the research that Dr. Fumito Ito is working on, or more broadly, we have breast fellows who spend 1 year of their training with us to learn the specifics of breast cancer surgery, and their education pursuits is something we could receive gifts for. And then finally, we have clinical opportunities where something as simple as a breast cancer awareness campaign, or offering to pay for additional screening mammograms, or enhancing our image enhancement center where women get prosthetic bras, wigs, scarves during their cancer journey. All of these would be ways that we could use gifts towards bettering the lives of the women, and also just bettering our knowledge and treatment of breast cancer. It's tremendously important to give back and donate to these causes, because it really creates an impact. So that ripple effect of the gift will not only touch the providers, the care team, the patients, the institution. It can have that huge ripple effect of enhancing the whole program. So if you are someone who is curious or grateful or has capacity to provide a gift to our program or the greater program, would welcome your support, and thank you.